Hello, I'm Matthew Jackson. I'm an osteopath and I work from Glastonbury Surgery. I'd like to talk to you today about Raynauds phenomena or disease. Raynauds is a problem with one's hands or one's feet where the circulation is impaired. There is pain and discomfort at the feet and hands in cold weather or in stressful situations where naturally the blood vessels will contract. This extra contraction is caused by a spasm of the blood vessels and it can cause a lot of pain and discomfort. With this poor circulation, it impairs wound healing, and sometimes in very pronounced case there can be ulcers on the tips of the fingers which don't heal. There's primary and secondary Raynauds, and the difference is that primary Raynauds exhibits itself on its own, so it's not associated with other conditions. Primary Raynauds usually affects women and from a young age of 14, but sometimes can spontaneously resolve about 30 to 40 years. Secondary Raynauds is usually diagnosed with an abnormal blood test. So with both sets of Raynauds, we encourage patients to have their bloods taken just to check if there's any other associated condition. Now, they're usually connective tissue disorders such as lupus, scleroderma or vasculitis. These conditions can be treated. They're treated by vascular consultants, dermatologists, plastic surgeons or rheumatology, and they're treated with drugs such as calcium channel blockers, which dilate the blood vessels and allow more blood to go to the area. Phospholipase inhibitors, drugs such as Viagra's, will also dilate the blood vessels and free up the blood flow to the peripheries. And also some pulmonary hypertensive medications. It's important that your Raynauds is treated, and we encourage everyone to go and visit their doctor and to try to find out if there's a way that they can be helped. Raynauds Awareness Month, and during this month we'd like to try to do our best to bring some awareness to this condition. We're delighted to have Thermal Vision Research which have sponsored us by using some of their very amazing thermal cameras. So we're going to invite people who are suffering with the condition. What we'd like to find is an uncomplicated condition, so not associated with another connective tissue disorder. So primary Raynauds, somebody who suffers with very cold hands and feet. It has been diagnosed as Raynauds, so typically there'll be whitening or purple hands on cold or stress. We're going to take a before picture with the thermal camera. This is after one puts hands in water and then afterwards. And we're going to measure the blood flow, how it gets back to the hands. Then we're going to give 6 to 8 weeks of Chinese herbs. So this is herbs to help better the blood flow and quicken the blood and make it easier to nourish the feet and the hands. After that, we're going to stop the herbs and we're going to measure again in another 8 weeks. So we'll have these 3 touch points, so before, after treatment, and then see if it has held at the end. So it's going to be very interesting for us, so please, if you suffer with it yourself or you know of somebody that could benefit from this treatment, please share the video and let's create more awareness for Raynauds and see what we can do to help this condition. Thank you very much. Bye-bye.